Good news! This last November, the United States Food and Drug Administration gave the thumbs up to a new injection called Zepbound for helping adults deal with weight issues. If you have a body mass index of 30 or higher, or a BMI of 27 or higher with weight-related problems like high blood pressure or diabetes, Zepbound might be something to consider. Zepbound joins other newer weight loss medications such as Mounjaro, Wegovy, and Ozempic. Zepbound actually contains tirzepatide, which is also the active ingredient in Mounjaro. The FDA's approval is a big deal because obesity and being overweight are linked to serious health problems like heart disease, stroke, and diabetes. With about 70% of American adults dealing with these weight issues, there's a need for effective solutions. Here's how Zepbound works. It targets hormones from the intestine, reducing appetite and food intake. You take it by injecting under the skin once a week, and the dosage increases over several weeks until it reaches a target amount of 5, 10, or 15 milligrams once a week. The highest dose is 15 milligrams once a week. Zepbound is proven to be effective in managing chronic weight issues, including both weight reduction and maintenance. This was demonstrated through 2 rigorous studies involving adults with obesity or overweight, each dealing with at least one related condition. The studies, which were randomized, double-blind, and placebo-controlled, spanned 72 weeks and included a total of 2,519 patients receiving weekly doses of 5 milligrams, 10 milligrams, or 15 milligrams of Zepbound, along with 958 patients who received weekly placebo injections. In both trials, after the 72-week period, individuals taking Zepbound at all 3 dosage levels experienced a significant reduction in body weight compared to those receiving the placebo. A higher percentage of Zepbound recipients also achieved a notable weight reduction of at least 5% when compared to those on the placebo. In the larger of the 2 studies, adults without diabetes were enrolled when the trial began. The average weight was 231 pounds, with an average body mass index of 38. Participants who were randomly assigned to take the highest approved dose of Zepbound, which is 15 milligrams once a week, experienced an average weight loss of 18% compared to those who were given a placebo. In another part of the trial involving adults with type 2 diabetes, the average starting weight was 222 pounds, and the average BMI was 36. Those who were randomly selected to receive the highest approved dose of Zepbound showed an average weight loss of 12%, in contrast to those who received a placebo. Zepbound may lead to various side effects, including nausea, diarrhea, vomiting, constipation, abdominal pain, injection site reactions, fatigue, allergic reactions, typically accompanied by fever and rash, burping, hair loss, and gastroesophageal reflux disease. Additionally, in studies with rats, Zepbound has been linked to the development of thyroid C-cell tumors. It remains uncertain whether Zepbound can cause similar tumors, including medullary thyroid cancer, in humans. As a precaution, individuals with a personal or family history of medullary thyroid cancer should avoid using Zepbound. Zepbound has not been tested in individuals with a history of pancreatitis or severe gastrointestinal disease, including severe gastroparesis, which is a condition affecting stomach muscle movement. It is not recommended to use Zepbound in combination with Mounjaro or a GLP-1 receptor agonist. The safety and effectiveness of using Zepbound alongside other medications for weight management have not been established. Patients with a history of a severe allergic reaction to tirzepatide, the active ingredient in Zepbound, or any of its components, should not use Zepbound. If a severe allergic reaction is suspected, patients should discontinue Zepbound immediately and seek medical assistance. Zepbound also comes with warnings for inflammation of the pancreas or pancreatitis, gallbladder issues, low blood sugar or hypoglycemia, acute kidney injury, diabetic retinopathy, which is damage to the eye's retina, in patients with type 2 diabetes mellitus, and suicidal behavior or thoughts. Individuals experience symptoms of pancreatitis or gallstones should consult their healthcare provider. If Zepbound is used alongside insulin or a medication causing insulin secretion, patients should discuss potential dosage adjustments with their healthcare provider to reduce the risk of low blood sugar. Healthcare providers are advised to monitor patients with kidney disease, diabetic retinopathy, depression or suicidal behaviors or thoughts. Before thinking about Zepbound, it's crucial to talk to your healthcare provider, especially if you have a history of pancreas issues, allergies to tirzepatide, or other health concerns. The FDA has fast-tracked the approval of Zepbound due to its potential to address the urgent need for effective weight management. If you have any questions about Zepbound or any other medication or nutritional supplement, feel free to email me at michael@pharmacistmichael.com. If you want more information on different medications and nutritional supplements, please subscribe to our channel. We release 3 videos each week on health and wellness issues. My name is Pharmacist Michael. Be happy and be healthy.